Nick, can you also message the link to Priya?
Yeah, okay, 1 second.
Sorry. So for people who are waiting, bear with us. We apologize. We're having people message us from different platforms trying to get in. So we're trying to make sure everybody gets in, but we will start soon.
All right, I'll go ahead with intros. So I'm Nick. I'm one of the owners here of Stave Off. And we thought this would be a perfect time and place to hold this. With COVID going on, everyone has started running more because that's the only thing that's open. Not as of Friday, but for the last couple of months, it's the only thing that's been happening. And I think Maura is the best possible person to run this because she is a very active runner herself and has been doing this for a while. So I'll let her kind of take the reins, and I'm going to be moderating the chat. So if you have any questions, you can reach out. You can feel free to reach out at any time, and I'll kind of be doing that side of things.
All right, so we shall start. Hopefully no one else wants to get in. Okay, yeah, so hi everyone, my name is Maura Leslie. Oh,
Maura, 1 second. So if you, when you share your screen, there's a participants thing down at the bottom.
Okay.
You can still admit people while you're sharing it.
Okay, never mind. Okay, so hi everyone. Thank you so much for coming, although I can't see anyone. So my name is Maura Leslie. I am one of the 3 physios at Stave Off. And as Nick said, we wanted to give this presentation because we have been finding that there are so many people who have started running or have ramped up their running, especially during COVID because, you know, most gyms haven't been open and the weather's getting nicer. So we thought that we would give some information on running related injuries and training plans and all that fun stuff. So I will be sharing my screen so you can see the presentation, and we're going to be recording it. So if you want that afterwards, just let us know. I am going to ask a few questions. So we'll direct you to the chat box for that. If you have any questions at any point, you can type them to everyone. So there's a little scroll down menu where you can put it to everyone or specific people. So if you want it to be a private message, you can either direct it towards myself or Nick, who will show us Christina Previtt, and we'll get those answered, okay? Yeah, all right, so I will start with the presentation. So, all right. So, running pain-free. So, what we will cover today, we're gonna start with why we run. We're gonna go through some common myth busters of running. We're gonna go through some common running related injuries. Then talk about injury management and injury prevention. We're gonna talk a little bit about gait, so gait assessment, gait analysis, what kind of things we like to think about with gait, and then go through training plans. So if there's anything that I'm not covering that you would like me to, sorry about that, talk about, just put in the chat box and we'll try to cover it, okay? So why do we run? So biggest reason why most people run is for improved health. So running really helps with cardiovascular health, so heart health, physical health, and it also plays a huge proponent into mental health and emotional health, or mental health and well-being. It leads to a reduction in all-cause mortality, and it also helps with the prevention or reduction against many chronic diseases. So ones that I like to touch on are type 2 diabetes, osteoarthritis, hypertension, so high blood pressure, and then different forms of respiratory illness, so illnesses in our lungs. So my why. I like to talk about this a lot because I think it's really important that people know their reasons for running because it helps so much with motivation. So my why for being a runner and treating runners. It gets me outside, which is awesome at all times of the year. It's a sport that I can do as I age. bonding with loved ones. So most of my family are runners, so it's really fun to do that with them. It's a great way to travel. I know most people are not traveling right now due to COVID, but when you go places, it's so great to run to explore the area. I find it to be a huge stress relief as well. And then for me, treating runners is awesome because I get so much enjoyment out of helping people who have similar passion to me. So we're gonna go through some myth busters. I'm gonna ask some questions, and if you feel comfortable, I'm gonna get you to put your answer into the chat box, and Nick will just kind of go through what the majority of people are saying, and if you don't, I'm just gonna get you to think about it, okay? So first question, rear foot striking is not okay. So if you don't know what I mean by rear foot striking, it's having the first part of your foot hit the ground be your heel. Okay, so rear foot striking is not okay. True or false? Any answers, Nick?
Yeah, right now we're about mostly false.
Mostly false. Okay, awesome. That is correct. So that is false. Majority of runners actually make initial contact with the ground using their heel, and research shows that this is totally okay and it's normal. So I'm super happy that most people said false because this is something that people usually get a little bit worried about, okay? Next one, strength training is bad for runners. True or false? Ooh, I went way too quickly on that.
Most said false anyway.
Okay, awesome. It is false. So strength training is and should absolutely be an important part of every runner's training plan. So we're going to talk a lot about this later in injury prevention and management. But I want people to start thinking that a stronger runner is a faster runner, okay? Next one, there is only one perfect or ideal running gait. So by gait, I mean the form that you use when you run. True or false?
We're getting mostly false.
Okay, any truths?
No. And a couple I hope it's false.
Okay, good. People are smart. All right, awesome. Okay, so that is absolutely false. So everyone will run differently, and there's typically no optimal or normal gait to strive for. So gait retraining, which we'll be talking about at the end, may be a part of injury management. So we'll talk about this later. But overall, bodies tend to run the way they are most comfortable in a way that is optimal for them, okay? So next one, running can cause or will result in higher likelihoods of developing osteoarthritis. True or false? Nice, I see the chat box blowing up.
Yeah, I've got mostly false again. Pretty much
false.
Yeah.
Sweet. Okay, that is false. So with research, what research studies show is that when comparing non-runners, so people who live a more sedentary lifestyle, recreational runners, and elite or professional runners, so recreational runners could be defined as anywhere between the non-runners and professionals. It's shown that recreational runners, so that middle group, have the lowest incidence of osteoarthritis in their hips and their knees. And most people extrapolate that to mean that running is protective. Next one, pronation is bad. So for people who don't know what pronation is, it's when, so if this is my foot and this is the inside of my foot, it's when your foot goes through and kind of drops on the inside when you're running or walking. True or false?
Got pretty much all false again.
So smart. Maybe these people don't need the presentation. All right. Okay, so false. Having your foot go through pronation is completely normal and natural. You need to go through pronation, and it's expected when running and walking. So I like to get people to think about this when they are buying running shoes, especially, okay? Because a lot of people at running shoe stores like to talk about pronation. Next one. The most important thing to consider when buying a running shoe is comfort. True or false?
Well, pretty much all true.
Bang on. Amazing. I definitely expected some people to say the wrong answer on this, so.
It's a little different now.
Oh, well.
Half.
Okay, so this is true. Again, we're going to talk a little bit more about this later, but comfort is always key when picking out your running shoe, okay? So, running related injuries. So in some of the slides, if you're looking through them after, I call it an RRI, but it's running related injuries. So they are common. So with any sport, and yes, running is a sport, comes the risk of injury. Depending on the studies you're looking at, the ratio will change, but most common ones that I find say that risk of injury ranges from 24 to 85% for runners. So that's pretty high. Running related injuries typically happen when your load exceeds your capacity. So when we talk about load, we are talking about how much you are doing. So how much you're running, how you're running, the other stresses that you're putting on your body. And with capacity, it's how much your body can handle at that point, okay? So running related injuries as well are often caused by overuse, and they are multifactorial, okay? So it's not just one thing that's usually causing it. So we'll talk about multifactorial looks at injury. So I tried to show how there are many different aspects that play into injury management, and recovery from injury. So the one that people think about most is the physical dimension. And this is the physical load you're putting on the body. So, you know, you're running, how much you're doing it, your mileage, hill training, anything like that, and the other activities that you do in your daily life. One that I talk about a lot is the lifestyle and environment. So your support systems, who you have supporting you, how you support yourself, your access to training. So do you have a safe space to train in? Do you have access to running trails? Do you have access to a track? Do you feel comfortable there? The sleep that you get, your nutrition, and how you recover in general. Another one that's big is the psychosocial aspect. So stress plays into injury. The relationships that you have play into injury. The relationship that you have with running plays into injury. Your beliefs about injury are really big, and how to recover. And then two other ones that play into it that I like to talk about are mechanics and training. So mechanics is more gait, how you're running. Training we'll look at in training plans, and then treatment. So do you seek out healthcare practitioners? Are you seeing a physio? Do you see a massage therapist? What kind of treatment do you do at the end of your runs? Anything like that. Okay, so all of these factors can go into injury. It's not just the physical aspect of running. First injury that we're going to talk about is called patellofemoral pain syndrome. So just to preface, I'm going over, I think about 6 different injuries, common running related injuries that I most often see. If you have questions about other ones, just put it in the chat box, okay? So patellofemoral pain syndrome, also called PFPS or runner's knee. This is the most common running related injury that people typically sustain, okay? So what it presents as is pain in the front of your knee, in and around the kneecap area. People who are sustaining this injury typically have pain with running. They'll also say that they have this pain when they're going down the stairs or jumping. Treatment for this usually incorporates some sort of quad, so front leg strengthening, as well as glute or hip muscle strengthening. Looking at your load, so looking at your training plan, how often you're running, what kind of rest you're taking, and possibly looking at your gait and seeing if you can make any changes there. Next one, iliotibial band syndrome. So this can also be called ITB syndrome, ITB friction syndrome, although it's most commonly called ITB syndrome. So to start off, we're going to talk about what the ITB is. So if you see in the picture on your left, the ITB is a long band of connective tissue. So it's that long white one that extends from the top of your hip all the way past your knee joint. And it is connected to many different muscles that we use when we're running, such as our glutes, our hip flexors, our quads, and our hamstrings, okay? But the ITB is not a muscle itself, so it's not a contractile tissue. So ITB syndrome is the second most common running related injury that people typically report, and it's said to occur in about 10% of runners. It typically presents as pain in the outside part of your knee, so as the ITB passes the knee, and can actually migrate into the top of your shins as well. It's usually caused by a sudden increase in training load. So when people, for example, are going from running 5 kilometers a week, spiking up to, let's say, 25 kilometers a week or 30 kilometers a week. We saw this a lot in COVID, people starting to run a lot more. And then some people also say that it could be caused by weak hip muscles or weak glutes, but this is unclear according to the research. So typical treatment for this is strength training and also looking at your load and how we can manage that. So again, looking at your treatment plan. So with ITB syndrome, I always like to touch on foam rolling because most people tend to think that the number one thing they should do if they want to keep away any ITB pain or they want to recover from this is to foam roll. So in some aspects, this could be good because it can take some pain away, maybe temporarily. But in the long term, it really won't do very much. So I like to tell people that if they like to do this, continue to do it, but it shouldn't be the focus of your injury management, especially for this one, okay? So next common running related injury, plantar fasciitis. I feel like probably everybody has experienced this one. It's common not just in runners. So plantar fasciitis is pain at the bottom of your foot, most commonly felt in the heel, but it can also extend through your foot into the arches. So again, it typically presents with pain there, and it's actually common after exercise. So walking, running, anything like that. So sometimes people don't experience it when they're actually running. They'll just start to feel it afterwards. And most people also will have pain or discomfort in the heel area in the morning. So that's super common. Typical treatment for this, again, load management. So you'll probably see that this is becoming a trend. Looking at your load is really important with running. And most physios will look to tackle your ankle range of motion, so see what that's like, calf strength, foot strength, so how strong the little muscles in your foot are, and the big toe range of motion is really important too. Next one is Achilles tendinopathy. So the Achilles is kind of the tendinous extension of our calf muscles. So it attaches our calf muscles to our heel bone. So what happens when you have Achilles tendinopathy is you typically get pain along the back of the heel, which increases with activity in general. And it may be worse in the morning as well, just like plantar fasciitis. So to differentiate between plantar fasciitis and Achilles pain is typically a little bit higher up instead of at the bottom of the heel. So sometimes when people have Achilles tendinopathy, they can also have swelling or thickening of the Achilles tendons. So some people might actually notice that their socks might feel tighter or their shoes might feel a little bit tighter in that area because the Achilles is actually thickened a little bit. Typical treatment for this, loading. So with loading, I mean strength training, strengthening it up. So there is an abundance of research showing that tendons like the Achilles tendon respond incredibly well to loading. So a lot of people might say, oh, I've heard that people or runners need to do their calf raises. And this is one of the examples as to why. Common exercise used for loading the Achilles tendon. And then load management, just like most other injuries. So looking at how much you're running, whether we can change this if we need to. With Achilles tendinopathy too, especially with load management, a walk-run program is not uncommon to see with your rehab. Next one, shin splints. I've seen this a lot as well post-COVID. So it's also called tibial stress syndrome. Some people might hear medial tibial stress syndrome. So what it typically presents as is pain along the front of your shin bone, which is also called your tibia, or a little bit deeper in behind the shin bone or on the inside. It can be sort of touched, but it isn't always. And with shin splints, most people have pain before and after their run. So a lot of people will say that their pain will start to ramp up at the beginning. It will kind of stay stagnant or even disappear during the run, and then it will start to come back once you're done. Typically, not always. So treatment for this, again, volume and load management. So going down to that walk-run program isn't isn't uncommon. And if you don't know what the walk run program is, we're going to go over it a little bit later. A lot of times people will think about looking at your gait, how you're running with this, if we can change it up to try to decrease some symptoms, and then strength training. Next one, hamstring strain or tendinopathy. So strains and tendinopathies in general are a little bit different, but I'm grouping it all into one. So hamstring injuries. They present typically as sharp or achy pain in the back of your leg, close to your glutes or close to your knees. So the hamstring extends from your hip area down past your knee. So depending on what area is injured, then it could present higher or lower. People with hamstring injuries will often have pain when their foot first contacts the ground. So when you're walking or when you're running, but typically when you're running, and it's often really sore or slightly tender when you touch it, okay? Typical treatment for this is load management, looking at your load, looking how much you're running, strengthening up the muscles that have become injured so that they're strong enough to tolerate what you're asking them to do, and also possibly looking at how you're running. So the last one that I want to touch on is bone stress injury. May not be as common for this group of people who are on right now, but in the running world, typically I would say is one that most people are afraid of getting. So most people hear stress fracture, but the overlapping term is bone stress injury. And in general, what it's considered is an imbalance between the load-induced microdamage and remodeling of your bone. So if that makes no sense to you, essentially what happens is when you load a bone, there's a certain amount of damage and breakdown that happens, and then it gets reabsorbed and made into a stronger bone, in plain terms. And what happens is sometimes that continuum can be disrupted, or it's not working as it should be, and you can get a bone stress injury. So this can range anywhere from what's called a bone stress reaction all the way to a stress fracture, which is more commonly thought of. So when people have a bone stress injury, they typically have pain with weight bearing or use of that part of their body. Again, depending on where you are on that continuum, it's going to be more painful or less painful. Common sites to have bone stress injuries are your pelvis, so in and around your hips, your shins. Some people can think they have shin splints, but it's actually a bone stress injury. Your metatarsals, so those are the small bones in your foot, and then also your femoral head, so the end of your long bone in your thigh where it attaches to your hip. Treatment for bone stress injuries, again, multifactorial and depends on the situation, but if there is a bone stress injury suspected, then you will be told to immediately stop running for at least 2 weeks. And you will be referred for imaging more than likely and further medical care. And most people ask about the return to run timeline, and this will depend on many factors, including the severity of the bone stress injury. So where you are you closer to the stretch fracture, or are you closer to that bone stress reaction? All right, so.
Hey, Maura, before you get started, I think there's a couple people in the waiting room.
Oh, are there? I don't have, it doesn't say there. Oh, here we go. Got it.
There you go.
Sweet. Does anybody have any questions so far? All good? Okay. Now, how do I go back to this?
Hi, Janice. Yeah, you definitely can. So we're going to be sending out the slides and the recording to everyone who is registered for the workshop. So we'll definitely be sending that out probably tomorrow or the next day.
All right. Anyone else have any questions before I keep on going? All right. So injury management. So oftentimes injury management will require a modification in your current running schedule. So that likely makes sense to most people as most of the treatment I talked about or mentioned in each running related injury talked about load management. So this can be modification of the frequency of your running, so how often you're doing it, the intensity, how hard you're working, or even duration. So for longer distance runners, we may get you to shorten up your run a little bit. Again, completely depends on the scenario. But I want to point out that you will not always be required to stop running. So a lot of people get really fearful of this, and I totally understand that. But know that if I can keep you running, I will, because it is not fun to tell someone they can't do something they enjoy. So we will try to keep you running as much as we can. And another thing that is really important to point out is that it requires a lot of dedication on the athlete's part. So if you are going through a running related injury, try to have a little bit of patience with yourself, because it definitely requires a lot of work on your part. Injury prevention. So injury is not 100% inevitable. You can do absolutely everything that I say in this presentation and still have the possibility of being injured. It's kind of just how it works, unfortunately. But doing what you can to prevent injury is never going to be a bad thing, okay? So typical base points that I like to hit for injury prevention are making sure that you have a proper progression in your mileage or your intensity or your frequency of your runs, okay? We're going to go over this a little bit more in training plans, but making sure that it makes sense to you or it makes sense to the people that you are running with or your run coach is really important. Strength work. I'm a huge proponent of strength work. Nutrition. So making sure that you are feeding yourself properly, just in general, and for your runs after you work out. And then recovery. So it's pretty common to hear people say that when you train hard, you need to recover harder. And recovery can include many things for most people, but most common things are, again, how you're feeding yourself, your sleep, and your rest. So this differs for everybody, but those are pretty basic ones that most people hit to work on their injury prevention. Strength training. I love strength training. So why do we do it? It's incredibly important for injury prevention. So the stronger you are, the more resilient you are in every scenario, okay? Injury management. A lot of the times with injuries, you need to build your load back up, you need to build your capacity back up, and the way to do that is to make sure that you're strong enough to handle what your body is asking you to do. So you're going to have to up your strength work. And in general, a stronger runner is a faster, more efficient runner, okay? So you can do so many things with your strength training, which is part of the fun of it. But typically, a lot of runners will like to work on single leg work. And this is because when you're running, you're never on two legs at once. You're always using one leg. So it's really important to make sure that you have good single leg strength and balance and stability. So torso strengthening. So when I talk torso, I'm not just talking about ab muscles. I'm talking about anywhere from your chest and shoulders down to your hips. And this is important because your torso in that area needs to be nice and strong and stable as you continue to run, especially for those longer distances. And plyometrics. So this is a pretty common one for runners too. So plyometrics is, jumping activities, high intensity activities like that. And these are good to work on because running is essentially just multiple single leg hops back and forth continuously. So working on the ability to do that is always a good idea. Lastly, for strength training, don't be afraid to load yourself. So a lot of the times I will see runners think that doing body weight exercises or really low weight, so grabbing those 2-pound, 5-pound dumbbells is all they need to do. And while that is absolutely phenomenal and a great starting point, it is not a bad thing to load yourself up. So to grab those heavier weights, make your muscles stronger, anything like that, okay? So don't be afraid to do that. If you have access to that, of course. I know it's difficult right now. And there's also different ways to load your body. If you have questions about that, if you don't have access to more weight, then you can ask about that a little bit later. So gait. Gait is one that I find people get really caught up on or really excited about or kind of fearful of. So I'm going to touch on the basics here that I think is pretty much the extent that most people need to know, okay? So gait analysis, meaning someone looking at your gait, and gait retraining, so someone trying to change your gait, are not the be all and end all of injury management and prevention. So a lot of people think that if they have an injury and they change their gait, that they're going to be 100% better, and that is not true, unfortunately. So again, just like we talked about at the beginning, there is not typically one perfect gait that everyone should strive for if they are pain or injury free. So my rule of thumb is if it's not broken, do not fix it. Okay, so if you're not having pain or discomfort when you run, then there is really no reason that you should consider changing your gait. So just like I talked about at the beginning, our bodies run the way they feel most comfortable and most optimal, and it may look different for everybody, but if you don't have pain with it, then there's no reason to change that. Okay. On the other hand, if you are experiencing pain or running related injuries, then gait analysis and training may be a part of your rehab or management, but it's not going to be all of it. Okay. So when we're looking at gait analysis, a physiotherapist or a run coach or a run specialist will get you to run on a treadmill. COVID, they'll get you to run outside and try to videotape yourself, but best is done on a treadmill. They'll look at your front view, view from the side, and view from the back, and they'll be taking videos. And then going through them themselves and with you in slow motion to try to pick apart your gait a little bit, see if there's anything major that you can change or maybe contributing to the injury that you've sustained. So the biggest thing that we're looking for when we're looking at gait and analyzing it is where your foot is landing. So when we're looking at where your foot is landing, we're concentrating on where it's landing in relation to the rest of your body. So the most common mistake that people, I'm going to say mistake, that people make is reaching out in front of them with their foot, which is also called overstriding. So if you see in the picture at the bottom, the one on the left in yellow, it says overstriding, and the one on the right, they're not overstriding. So you can see with the one on the left that their heel is kind of reaching forward in front of them. So this may distribute force with each step in an unoptimal way and could possibly be contributing to a running related injury. So to explain this a little bit more, when you're running, what you want is your force to be going down into the ground so it can propel you forward so that you are running as fast and efficient as possible. So when you're doing that, when you're overstriding, what happens is your foot is in front of you and it causes this force angle to go back. So what happens is with every step you take, instead of propelling yourself forward, you're essentially pumping the brakes on the force that you're putting into the ground. And then to take the next step, you have to produce more force to do it. So you're consistently putting on a braking force instead of moving forwards. And you're also not lining up your joints, so your ankles, your knees, and your hip, in the most optimal way to receive this force. So essentially, if you're comparing one picture to the other, having your ankle and your knee and your hip a little bit more in line, like the picture on the right, typically is handled better in your joints, okay? But a little asterisk here, there are a lot of people who overstride and have no issues. So again, if it's not broken, don't fix it. Training plans. So this is where we really look at the load versus the capacity. So what we talked about as kind of the bread and butter of running related injuries. So you really get to list out, let's say on a calendar, how much you're doing and making sure that your load is not too much or is enough for what you want to accomplish. So when you're making a training plan or when you're picking a training plan for you, it's incredibly important to understand what your body can handle, which takes a little bit of work and self-reflection and also practice, and how to increase your training load. So that's why I like to say, if you're not aware of this, try to seek out some education, so stuff like this, or even contact your physiotherapist or run coach to see if they can help you with this. Common training errors that we most typically see are a too fast or high increase in mileage and skipping your easy runs. So simple rules to follow for your training plan. So if you're making one for yourself, starting point, a run walk program. So a run walk program is really great for people who haven't run in months. They're not used to it. or if you are starting running for the first time ever. So with a run walk program, what you're going to do is you're going to split up your run into intervals of running and walking. So a good example of this is starting with 30 seconds or a minute of running and then 1 minute of walking for a total of 15 minutes. Do this for 2 or 3 runs, whatever feels comfortable for you. And then you'll work up those intervals of running. So for example, over a few weeks, you'll work into a 5 minute of running and then work down the walk intervals. So 30 seconds of walking and do that for about 25 to 30 minutes. So again, this is just an example that I typed up. What the intervals look like will completely depend on your goals and what you want to achieve. So if you're looking at increasing your distance in your training plan, this can be disputed, but a solid one you can go off of, or a solid rule that you can go off of when you're doing your own training plan, is making sure that there's no more than a 10% increase in mileage per week. So by this, what you can do is calculate how many miles or kilometers that you're running in 1 week. And when you're setting up for the next week, making sure that that number does not exceed 10% more than the previous week. Okay, so just a little bit of simple math. And that really helps to make sure that you're not increasing the load too much. Intensity, so how hard you're working. A lot of people will say that 80% of your runs should be easy runs, okay? So some people just go out for a run in general and they never really change up their workouts if they're doing, like, they don't incorporate hills or anything, which is totally fine and awesome. But if you're incorporating harder runs, then in general, you want a good majority of your runs to be easier, okay? So easy is different for every single person. For me, what I term as easy is if I can comfortably maintain a conversation for the whole time. There are many different ways to perceive easy. You could be looking at rate of perceived exertion, heart rate, anything like that. But the talk test that you can do is an easy one, okay? So when working with a coach or a physiotherapist, when you're making up your training plan, it's really important to make sure that your plan is centered around your goals and your schedule, because when it is, it's much easier to follow. Okay, so it's going to be a collaborative effort. Running in the heat. I thought I'd add this one because we have been, I'm not sure if everybody's from Kingston here, but we've been having a ridiculous heat wave, and I personally know that I have been struggling to adapt to it. So some general facts for running in the heat. Our bodies are working way harder in the heat compared to when it's not as hot, okay? So it's gonna feel a lot different. So tips that I have, for the first 2 weeks or so while you're running in the heat, and I know this is difficult because sometimes we have 1 week of extreme heat and then it goes back down to something that's tolerable, so do what you can. But in general, for the first 2 weeks, good things to do to adapt to the heat is slowing down your pace. So if you know a pace that you typically run at, try to slow that down because your body is working harder at that pace than it typically does. Decrease your distance. So this can be, for 3 runs a week, or it can be for a total of 2 weeks. Running in the morning is never a bad idea. In general, it's going to be a lot cooler, so your body will be able to adapt to it a little bit better, or it just won't be as difficult. Sun protection is incredibly important. So as you can see in this picture, hat, sunscreen. If you're comfortable wearing longer clothing that might be like heat protective or anything like that, that's always a good idea. Hydration. Hydration is probably the biggest one. So making sure that you are drinking enough before and after your runs is so important. As well, bringing water on your runs. And a reminder that you don't need to have like a fancy run belt or anything like that, a backpack to bring water in your runs. You can very easily carry a water bottle. Okay, so that's really important. And then trying not to compare. So this might not apply to everybody, but it's definitely been applying to me lately, so I thought I would share. So a lot of people have running watches, Fitbits, Garmin's, Apple Watches, anything like that, where they will record what they are doing, and they will look at their pace, their heart rate, the elevation, anything like that. And then a lot of people also upload what they're doing to Strava. So if people don't know what Strava is, It is essentially social media for exercise. So people post what they did, and you can see it on your feed. So it is really important, I find, when you're running in the heat to try not to compare yourself either to other people or to what you were doing before, because you are working way harder and those results are not going to seem or look the same at the beginning. Okay, so try not to compare yourself and just try to get through the process of acclimatizing, and it will feel much better once you're used to it. Running shoes. I'm only going to touch a little bit on this because I am 100% not an expert at running shoes. So what people typically hear when they're thinking about running shoes, and the different kinds, stability shoes, neutral shoes, barefoot shoes are sometimes popular depending on who you're talking to, and also minimalist shoes. So there has been so much research and so much money put into running technology and running shoes. And there have been a lot of claims put out, and there's so many things supporting one side or supporting another side, and a lot of disputes. But what most people can conclude in general is that comfort in a running shoe is your number one priority. So when you're at your local running shoe store, or when you're at Sport Chek or whatever it is, what I like to say to people is, no matter what someone is telling you to buy, if the shoe is not comfortable when you first put it on and walk around the store, then it is not the shoe for you. Okay, so make sure that it's a comfortable shoe that you're investing in. After that, in general, most people do best in a neutral shoe. So if you don't know what a neutral shoe is, it is talking about the stability. So on one end, we have a stability shoe, which doesn't have as much give. It has more support in the back of the shoe or the heel area. And then we have a minimalist shoe on the other end that really doesn't have support. Sometimes it mimics running without a shoe. So that can be anywhere in between. Okay, so there's lots of different neutral shoes, but in general, most people do the best in those. Okay, so take home points now that we've gone through everything. If it's not broken, don't fix it. So don't worry about changing your gait if you do not have pain or injury. Okay, you can look at it, you can analyze it, but you really don't need to if you don't have pain or injury, because once people start, it typically ends up flaring something up that wasn't there before. Strength training is so important. Injury management, injury prevention, and just daily life, it is something that you should definitely be incorporating. Running is not dangerous for your knees and your hips. So at the beginning, we went through the fact that it does not cause an increased rate of osteoarthritis. It's actually really good for them. So don't be worried about that. Training plans are important in injury prevention and management. If you don't feel comfortable making yourself a training plan, or you want some help with it just in general, or want someone else to look at it, please feel free to reach out to me, reach out to someone else you know who has a little bit more knowledge on running. And then lastly, comfort is always key for shoe selection. We're going to go over questions if anyone has them. I don't know if there are any being written in the chat box, but before that, I just want to say thank you so much for coming here on your Tuesday night. If you want to chat about anything, book in an appointment either in person or virtually. If you're not in Kingston, or if you're not comfortable coming in virtually, or you want any more information about physiotherapy, about running, anything like that, you can send an email to either of these two emails, so the info@staveoff.ca, or my personal, maura@staveoff.ca, or you can phone us at the clinic as well if you need absolutely anything, okay?
So everyone, Maura has done an absolutely awesome presentation. So we're going to leave this off. Any questions? I already see there's one or two in the chat there, but also if you want to unmute yourself and you want to have a more interactive conversation, you're also more than welcome to do that. Like, we have time for that. We have the room for that. So Maura, if you want to stop sharing your screen and we can do more of an interactive Q&A, there's also one there by Jamie Gray down in the chat there. So I can read it out if you want. You mentioned at the beginning that one of the treatments for tibial stress syndrome is strength training. Which muscles specifically would you be targeting? Would you be able to provide any examples of any exercises?
Definitely. Okay, so this could be kind of a complicated question, but I will try to answer it in the best way possible. So, for tibial stress syndrome and strength training, it's important to strengthen the muscles around the ones that are actually injured. So, the most common that are injured are called the tibialis anterior and the tibialis posterior. So, those are like shin muscles in general. They kind of are in around the calf muscles. So, most people will tackle strengthening the calf muscle specifically. So, using exercises like classic calf raises. I personally like to go all the way up to chain. So making sure that your legs are strong enough in general to support those small muscles. So I really like to work on glute strengthening, quad strengthening, and hamstring strengthening. So glute bridges, squats, deadlifts, single leg deadlifts, things like that, especially at the beginning when we're taking a little bit of pressure off the muscles that are working a little bit too hard or aggravated. So those smaller tibialis anterior and tibialis posterior muscles. And then it's really important with tibial stress syndrome to start strengthening and increasing the endurance of those two muscles. So the tib post and the tib ant. And that will be, you know, some more foot exercises. I like to use toe taps a lot, anything like that. So in general, depending on the physio you see, it will be different. But I like to start with the bigger exercises first. So squats, glute bridges, calf raises, deadlifts, stuff like that. And then get into these smaller muscles as we're likely changing how you're running and the load of it. If you have a follow-up question for that, just let me know. Hopefully that answered it.
That's really helpful. Thank you so much.
Oh yeah, no problem. I don't see where that's coming from, but no worries.
I think that was her.
Okay. Okay,
so there's another one that we mentioned. So you mentioned that heel striking is okay for the heel to land first. Mm-hmm. However, if you are a heel striking, would you not be overstriding?
Yep, you definitely could be. Absolutely, 100%. A lot of people also heel strike and they're not overstriding. But again, I want to throw it back to the fact that people could be overstriding and not having any running related injuries or any pain. So it may not be 100% the most efficient way of running, but if you are heel striking and overstriding and not having pain, then this is still okay because you won't want to change it. So I know that,
like Maura was saying, there's a difference between the most efficient way and the most efficient way for your body. So when they're looking at the most efficient way possible, they're looking at one anatomical position, meaning like the femur is this length, the tibia is this length. If you're not the perfect specimen, your running gait is going to be different. You might overstride and that might be completely normal for you.
Yeah. But yes, 100%. If you heel strike, you could be overstriding as well.
Is running safe for those with OA? Could it further prevent OA or would it not be safe for this population?
That is such a good question. I feel like Christina would love this one. Okay, so I would say yes. I think you shouldn't get other answers from other people, but yes. So the important thing with running with osteoarthritis is you want to manage your symptoms. So if you've been told that you have osteoarthritis, which most people as they age do because it's a completely natural and normal part of aging where your joints change. Some people have symptoms, some don't. So if you have high amounts of, like, let's say knee pain or hip pain from your arthritis when running, it would be important to work with a physio to try to change it up and get yourself strong enough so that you could slowly work to run in the way that you want to and for the distance and time or intensity that you want to. But just because you may have pain or discomfort with it one time you do it doesn't mean that you always will. In terms of preventing further osteoarthritis, one big thing with osteoarthritis is it's important to make sure that you are strong enough to support your joints, and running can definitely help this. So while I cannot say with 100% certainty that it will help prevent further degeneration or symptoms from the degeneration, I would say more, I can definitely say that it will help with it and with your overall health. Okay. And then the last part of that is
Arno is asking, can you talk a bit more about warm up and cool down?
Yes. Thank you. That is definitely something I forgot to mention. So warm up and cool down for running is often forgotten about because people just think that they can kind of leave and come back. I truthfully do this quite often, especially if I don't have enough time. But they are really important, especially the warm up phase. So some people have specific things that they like to do for their warm up. But in general, what you would want to do for your warm up is take anywhere from, let's say, 3 to 10 minutes. It can be longer if you want, to get your body moving, get your heart rate elevated and your muscles warm, so that your muscles are essentially like neurally prepared for the activity. So sometimes my warm up will be doing some different running drills or even some jogging up and down my street. So lower pace jogging. And sometimes my warm-up will be my own rehab exercises that I'm doing for myself. So my calf raises, glute bridges, some monster walks, squats, anything like that, but anything that gets you prepared for the activity that you're doing, kind of like if you were warming up for, let's say, a soccer game or a strength training session, okay? And then in terms of cool down, you can also do something similar. So you can do anything that's lower intensity that starts to bring your heart rate down. So a good one for running that I like to do is just simply ending your run, let's say a little bit before your house, and walking around the block to start to slowly lower your heart rate as you are still moving. And then you can also incorporate some stretching. So dynamic or static stretching, whichever is a preference to you. So next one, when it comes to the 10% increase in running distance per week, how many runs should or would you be going on per week for this to be most effective?
So I can tackle this one if you want, Maura. So
Yeah,
I think when you're looking at volume over, so people get confused volume in a short period versus volume over a long period. If you're looking at volume, you want to look over it over a week. So whether you're running 50 kilometers a week or you're running 10, it matters in terms of intensity of how hard you're pushing. But the biggest thing is how long you're running and how many kilometers. So if you're running, again, 30 kilometers, it doesn't really matter how many days that's over. You're looking at volume 10% above that the next week. So again, add 10% onto 30 and then add 10% onto that. Not how many days you're running. It's volume over a given week and volume on your body on a week, basically.
I would say with that as well, though, is let's say you typically do 3 runs a week and you're increasing your kilometers or your mileage up to 30 kilometers the next week. If you only have time to do one run and you know, want to get it all done, I definitely would not suggest that. But overall, I think it would depend. I know that's kind of a frustrating answer, but it would depend on what you're previously doing and also what you're training for and what your goals are.
Yeah, absolutely.
So that was Emmy. Emmy, if you have like specific questions as to what your training plan is now and how you can increase that or what you were thinking of, please feel free to send me an email and I can help you further with that one, because I think if I don't know more details, then I would have a hard time answering that one.
So next one, do you believe in an optimal cadence or just advise to run at whatever cadence is comfortable for you?
Interesting question. I'm still deciding if I believe in an optimal cadence, but I'm leaning on the part of no. A lot of people like to work on their cadence because most people say that 180 is the optimal, but a lot of research says that this isn't really the case. So in general, I would say yes, run at whatever cadence is comfortable for you. And if you're not having any issues with that and you're not looking to 100% increase your efficiency and performance, then I wouldn't worry about it too much. Hopefully that answers it.
I think that is it. If we have any last second ones, now would be the time.
That was a decent amount of questions.
Yeah, that's pretty good. If you guys look over this or you leave and you have questions a second later, you can always email us or message info or anything like that, and we will always be here to answer those.
Yeah. Oh, no problem, guys. Yeah, awesome.
Again, if you want to book in with Maura and get some more kind of in-depth one-on-one look at your running style or injury prevention, we're always here as well.
Yeah, and again, too, if you are not in Kingston, or if you are in Kingston and don't feel like leaving your house and and want some more advice or need anything, we also are doing online appointments. Okay? Awesome. Thanks so much, guys, for coming.
All right. Thank you, guys. That was awesome.
What are the emails?
Are info@staveoff.ca or Maura, which is MAURA @staveoff.ca.
Oops, I sent that to everybody.
That's all right. And you also sent it to me privately. Actually, you only sent that to me privately.
If you're looking for the emails, I just put them in the chat box. Awesome. Thanks, guys.
All right. Awesome, everyone.